first shift in the ER, I saw CPR in progress coming in, and the patient died in the trauma bay. And then
Not on your
then
first day.
there
My
was a
goodness.
gunshot
I'd have
wound
walked out.
victim who walked in. He was a gunshot wound.
I remember that story.
Hey y'all, welcome back to the Sister Series. We are two sisters by choice, navigating what it means to live and exist as young, Black, successful, great women in today's world.
Yes, yes,
I
yes.
am Mariah,
And I'm Elise.
and thank you for joining us. We have a great topic today, so we are going to jump into that after this candid conversation. Listen, y'all. Let me tell y'all what happened. This is a story time candid conversation. I've been waiting to talk to y'all because this happened today. I went to my son's second grade musical, okay? The second grade musical is like the production of the year. They've been working hard. They've been doing all the things. And let me tell you, normally the seating is open seating. However, they had an auction like at the end of the first semester of school. And one of the things on the auction was you could buy 4 tickets, like a pack of 4 tickets to the second grade auction for front row seats. So
Oh,
I
cute.
used my hard earned money to do that because that would ensure that I could be on the front row. I like to be on the front row. At least you know this. I don't
Yes.
care if my kids are going to play a rock. I'm going to
Huh.
pay $800 to be on the front row.
That's absolutely correct.
But it wasn't $800. But I spent money on this auction because, in an auction, it's like you going back and forth, like it's the highest bidder. They ended up having like multiple packages. But my point is, I don't care if I spend 25 cents or $2,500 on these tickets. I won them in the auction. I pay for them. These are my seats.
Yep.
So I asked one of the PTA members that I'm on the PTA with, like, hey, do I need like physical tickets when I go? Like, how will I be able to claim my seats? And she was like, oh, the principal already took care of it. You just show up. So when I got there, I noticed that there were names on the chairs at the front. I had to go by myself because my daughter also had an event that conflicted with the school musical. So instead of needing 3 out of my 4 seats, I only needed 1. So I let my friend know. I was like, hey, I have 3 extra seats, and there's 3 of them, her husband, her son, and then her daughter was going to be in the play or in the musical. So she was like, that's perfect. So when I got in the door, she was like, somebody's sitting in your seats, girl.
Ooh,
And
we.
when I went up there to tell her, like, hey, I think these seats belong to the Wilsons, she was like, well, that's rude, or something she said to her. And I was like, that's fine. I'm going to go scope out my seats and I'll let you know when to come up here because these are my seats. I go up there. I look at all the chairs. I go stage left center because that's where my seats are supposed to be. I make sure my name is on the seats. Big bold letters. It says Wilson's.
Period.
1, 2, 3, 4. There are 3 people in 3 of my seats. And so I politely go up and I'm like, hey, I think y'all are in my seats. I'm supposed to be sitting right here. And do you know that
Ooh.
this lady looked at me and said, are you sure? The lady,
Oh.
let me just let you know, the lady did not look like me. And this is no shade to white people. She was a white woman, but this is a learning lesson to anybody who is going to try to tell me something that I already know and ask me, am I sure? First of all, I was highly triggered because you know the way the world is right now.
Right.
I feel like
It was gaslighting.
because I look the way I look, you felt the need to ask me, was I sure about something? Ma'am, I know my last name is Wilson and I know I pay for these seats, so you need to get up.
And
And
literally that.
you know what? I there are certain moments where I'd be like, that was Jesus, because I know
Mhm.
I'm incapable. I know I go from 0 to 1,000 in like a
Mhm.
blink of an eye. Like, I'm super nice and I try to be super kind, but I'm human and sometimes I do get triggered. But
Mhm.
Jesus was all over me because I was like, my last name is Wilson. And then the people sitting with her were like, oh, because we bought seats to the same thing. First of all, sir, you're lying. And I was
Okay.
like, he was like, we had the same last name. He didn't look like me, Elise. And
There's no way.
I'm not saying that other people don't have the last name Wilson, but what a coincidence that
Right.
you also bought the same exact seats as me and your last name is also Wilson. And
Right.
then, just like any good Karen would, I pulled up my receipt. I said, "Do you have your email confirmation with your seats in it?" And then they proceeded to get up and start
Mhm.
stuttering and was like, "Oh, well, we were trying to buy the seats and something happened. They never
Get
contacted us."
yo.
Sir, I don't care. I'm here to see my son in my front row seat that I paid for. Please get up so my friends can come sit down in the seats that I paid for.
Right.
I was so triggered. And the
Yeah.
candid conversation, that's just what it is. It's just me venting. But here's a piece
Mhm.
of advice: do not ever in your life ask me if I'm sure of something that I told you, especially
Mhm.
in that kind of setting. Now, if it's somebody I know or love, you asking me like, "Are you sure?" Blah blah blah. That's one thing. But
Mhm.
please do not fix your mouth to ask me if I'm sure when I am telling you that I paid for something and you are impeding on my space or
Huh.
something that belongs to me. Just please kindly get up. And next time, go play with someone else because you're not about to play in my face. Did they think I
Right.
was gonna show up and be like, "Oh, your name is Wilson too? Okay, let me go to the back." No.
Mhm.
Like,
Mhm.
tell me,
Mhm.
sister,
Mhm.
what did they think was gonna happen?
I don't know, and I think you probably handled the situation a lot better than I would have.
I
I
didn't want to
would
get kicked
have
out because I wanted to see my little bat
yeah.
number 3 that my son was
And
a bat in the play, in the
and
musical.
and you have to think about your son, and you don't want to make a full scene, but the scene that I would have caused would have been embarrassing. And it's just because I don't know if I have that self-control just yet.
It's
Actually, I
Jesus. It's
probably would.
literally Jesus.
I think being a member of the PTO, having my email confirmation, and just knowing that I was correct, and you are sitting here gaslighting me and
I think
playing in
that's
my
what it
face,
was.
you can stand 10 toes down, and I'm going to tell you one more time.
Yeah.
This is my seats. These are my seats. You have a few seconds to get up out of these seats, or we will go deal with the principal.
Yeah,
I'm not
because what
spending
I
my
would
energy
have
on it.
done, I would have stayed where I was standing. I don't know if we would have been going back and forth. I would have found somebody who was working the event, found my fellow PTO people.
Yeah,
Hey, here's my email confirmation. This is my name. I shouldn't have to show you my
you
ID.
handle
You
that.
know me, yeah, but like I
Yeah,
want my seats.
yeah,
So, I mean,
and make it
I
quick.
I was trying to be nice. I
Yeah.
definitely was gonna stand my ground, but like,
Hmm.
don't do that. That is not
Right.
something. And you know what? Y'all met a nice person today because, like Elise
Right.
said, you might would have bumped into the wrong one, and that would have been a
Hmm.
whole scene because I know I
And
have
because
some.
you didn't have these seats,
Yeah.
they were not yours. Don't gaslight me. That's what
Yes.
would have sent me over the edge. Is that these seats were not yours.
And
You
when
know that you didn't spend a dime.
they were
And
like, "Oh, this is embarrassing." It is embarrassing for you because I'm pretty sure your last name is not Wilson. Like, the fact
right,
that you even lied about this is a second grade musical.
literally
Please go to the
skedaddle.
back. Like,
Skedaddle, scurry your
ugh,
way to the back. And as someone who works in a school, I know how the parents seating at musicals. Literally, when the doors are open, the people
yes,
be running. So
yes,
I fully understand you. I get up out this seat. I paid for this. Get up
yes,
out so I can sit down and watch my child before
yes.
I get angry because you are causing me to miss valuable time of watching my child or
And I was
preparing to watch my
already
child.
like flustered because I had to leave work a little early and then there was like crazy traffic, like even worse
Yeah.
than usual. So when I got him, I had to get him from the after school program, take him to the car to change. Like, it
Oh,
was just like,
right.
but we still made it on time. But then I was like, when I get here, I'm already flustered. And now you asking me, am I sure?
Right.
I think the am I sure question is really what triggered me more than y'all being in my seats. Cause it's a simple like, hey, y'all in my seats, y'all mind moving. But the fact that
Yeah.
you asked me if I was sure,
Yeah.
like, do I
What?
look stupid to you?
Right. Because what do you mean, are you sure? I wouldn't have marched myself up here and done this in front of all these people if I wasn't sure.
Yeah, because what I'm not gonna do is embarrass myself. So,
Literally that before I even get in contact with people like yourselves that
and
are
you
sitting in seats that don't
obviously
belong to you.
don't know who I am because I'm gonna check all my boxes. I had already reached out, figured out what
Mm-hmm.
I needed to have so I could
Mm-hmm.
claim my seats. I had already pulled up my confirmation email. Ma'am, don't play with me. I am more than sure.
To
Go play with
prevent this
somebody
from
else.
happening. You had
Exactly.
done all of that to prevent
Exactly.
any hassle
Yeah,
from
yes.
sitting.
And it still
Yep.
happened.
And that probably sent you over edge too. Like, what? I done did all this and y'all want to sit here and play in my face? Please, please get
I
up.
was unwell.
Oh,
But
sister,
anyway,
I know that that's a lot.
yes. It was a beautiful musical, and my little bat number 3, I copied that from my friend. She called her daughter, I
Oh,
think they were raccoons. She was like, I'm here to see raccoon number 3. And I was
I
like, yes,
love it.
my little bat number 3. He
And
did
I'm sure the show
amazing.
was amazing and he sung his little heart out.
And I enjoyed it from my VIP front row paid for seats.
And with that, we get into today's topic.
Yes. Take it away, Elise, because I'm done.
All right, everyone. Now that we have finished talking about our candid conversations, we have an amazing, amazing month prepared for you all. There's a lot of things to, period. There's a lot of things to celebrate this month. There's a lot of appreciation to give this month. It is May, the best month of the year, and there's one
Period.
reason why. There's the May
Reason.
is no, I was gonna put both of us together, Mariah.
Oh, my bad. Let me not jump the gun. Hey, don't leave me out.
So there's one reason why May is one of the best months in the year, and that's because Mariah and I have birthdays this year.
Burn, burn,
I
burn,
mean this
burn.
month.
Oh, guys, I got a burn, 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 burn button.
Oh, we need it.
Continue on. I'm gonna just
Use it.
Mhm.
And then another reason why May is an amazing month is because we get to celebrate not only teachers and nurses, but some of our very, very, very best friends. So we have quite a few fun, period. We have quite a few fun episodes planned for you all, and about every week this month we are going to have a guest. And as you all can tell, we have our first guest here with us.
Yay!
So I'm going to just ask you to tell us a little bit about yourself, tell us your name, and that's it. Just a little bit of something, because I'm about to get real deep with the questions for the nurses.
Dang, you couldn't even tell the people her name though.
No,
You
because some people want to say their own name.
Oh,
My
you're
name's
right.
Brittany.
Hi, Brittany.
Hi guys, thanks for having me on.
It's our pleasure.
All right.
Chick-fil-A style.
Yes. So we have our friend Brittany here, and if you have not, put two and two together. So here's the thing: nurses appreciation and teachers appreciation fall in the same week, and why is that?
Yeah, it's kind of problematic.
Yeah, problematic, but that's okay because we have a plan. So we are creating our own appreciation weeks. And so this episode is going to be geared toward appreciating our nurses. And not only do we have Brittany here as a guest on the pod today, but we have our very own host in the Sister Suite, Mariah, who is also a nurse, a practicing nurse practitioner.
That's me taking
and
it out, y'all. If you can't see
period.
me, y'all need to look on the YouTube.
LOL. So I am putting on my Oprah hat today for today's episode, and I'm going to just be asking
Not
some
Oprah.
candid questions.
Candid.
Yes,
It's really
candid
candid.
questions. Period. For the pod, and I just really want y'all to put your heart and soul into answering these, because really this could be inspiration for the future nurses. And then it just gives us the nitty gritty of what nursing is.
We don't have a
So,
heart and soul left, Elise. Okay, we left it on the nursing
It's
floor. Okay,
done.
bye.
Guys,
not on the nursing floor. That's all right. We're going to get the good, the bad, and the ugly in today's episode. So let's get started. So I'm just going to ask a series of questions. But for our listeners, if you have been a constant listener, you know that we struggle with, I in particular, struggle with
We,
staying on topic.
it's we.
Struggle with
We love
staying
a
on
tangent.
topic. Yes. So if you have something else you want to say, go ahead and say that too. I'm just facilitating today.
okay.
So first, we want to hear about your journeys, both of you. I know, Mariah, we heard a little bit about your journey, but tell us more. We're going to start with the guests because, we have manners in the Sister
Absolutely.
Suite.
We don't need to hear about my journey.
So, Brittany, starting with you, tell us about your journey into nursing and what was your path like?
Okay, so at least you already know all of this because we've known each other forever. But I always, even since we were in high school, I've always known that I wanted to work in the medical field. But in the beginning, I was going on the pre-med route and um I went to UNT. I got my first degree in biology,
Oof.
thinking I was gonna yeah. Actually, I really enjoyed my classes. I had a lot of fun, especially in like the lab. Lecture was a whole nother thing because
That makes one of us. I
uh,
hated biology.
I loved it. I loved labs so much. Like all my chemistry labs, I loved them so much. But lecture was another thing because at the time I didn't know I had real bad anxiety and
Mm-hmm.
ADHD. So, that's not the best for like hour, 2 hour long classes, just sitting there taking notes. My mind would be all over. Anyway,
Mm-hmm.
um, so I did my first degree in biology and I was like, okay, after college, I'm going to take a couple of years, work, get my application together. And I applied and didn't get in. So I kept working. I worked in a lot of jobs. Oh, okay, let me go back. Let's start at the beginning. I worked hospice, an inpatient hospice.
Oh,
Like,
no, ma'am.
that was my first ever like real medical job.
What did
And
you do?
I was just a receptionist. But I was like, now looking back, I was like a tech, basically.
I was about to
I was
say, I
like,
know
wait
they
a
had
minute.
you doing everything.
They did it because it was on the weekends. And of course, the weekends are short all the time. So I was basically a tech. I was answering call lights, getting people's food, getting them up to go to the bathroom, everything.
Not
They
Um,
was paying you
food.
to be a
What?
receptionist.
You as a chef too?
no, I was like bringing their trays and like help them eat.
Oh, a waitress.
No, that's what a tech is, please.
I'm
But
sorry.
also, yeah, you're not wrong. A waitress,
Yeah.
you still kind of am a waitress
You're
because
a jack of all trades in that position, sounds like.
yeah. So I did that for a couple years and then I moved on. Was my next job? Oh, I started scribing. So I started scribing in the ER. That was fun. My
I'm listening. I'm
Mariah.
listening. I'm sorry.
I didn't it was like kind of the same amount of like, I'm not supposed to do this, but I kind of can do this because we're short staffed. So they were like, well, somebody has to go do it. The scribe's not doing anything. She can go get it. Um, but I remember my first shift in the ER, it was this little hospital in Pearland. Like you wouldn't expect it, but my first shift in the ER, I saw CPR in progress coming in and the patient died in the trauma bay. And then
Not on your
the
first day.
there
My
was a
goodness.
gunshot
I'd have
wound
walked out.
victim who walked in. He was a gunshot wound,
I remember that story.
walked in, like he was wearing all white. All of his pants were completely drenched in blood. And I was like, huh? Are you kidding?
I'm
And
just
then
a scribe, y'all. I'm just writing down what I
right?
see.
I know. And I ended up working there for like almost 3 years because it was fun. And then at the same time I was scribing there, I started scribing in a neurology clinic, which made me really interested in neuro. So I worked with stroke patients, mostly stroke and seizure patients, a lot of migraine. I learned a lot about migraines and different interventions for those. Some stuff like with a bunch of neurological disorders like MS, Lou Gehrig's, psychogenic epilepsy, just like psychological seizures. I don't know if you guys have ever seen those before, but they're pretty interesting. Those people are typically pretty um unhinged. Um
We know
and
some
then
unhinged people.
yeah. So in the
Yes.
process of me, like, working all of these jobs, I was applying to medical school, but I was also getting to see the different roles in medicine, like medical assistants, nurses, physical therapists, EEG techs, the doctors, the NPs, the PAs. And so I was like, okay, so it's like I have options, right? I have options
Hmm.
to do things. And then the first time I applied, didn't get in. Second time I applied, got waitlisted, didn't get in. And so I was like, I'm getting older. Do I really want to spend another 2 to 3 years of my life applying for medical school only to then become these doctors who seem like genuinely miserable people?
Hmm.
No.
Heavy on that.
So I just weighed the pros and cons and I was like, well, nursing. Nursing has a
Hmm.
lot of flexibility. You can be a bedside nurse, you can be an outpatient, you can work from home, you could work in a clinic, you could do that's just like the tip of the iceberg. And so I
Hmm.
decided nursing and then I applied and got in, and now I'm a nurse.
Did you,
Period.
Brittany, do like a, I don't know what they call it at where you went, but like a fastback program? It's where you already have the
Yes,
degree and then you just have to do the
yes, I
nursing part.
did. It's an accelerated BSN. So I went to
Mhm.
UTMB and our
Okay.
program was 18 months. So
Oh,
back to
period.
back to back.
And I have to cut in and say that Brittany I was living with Brittany when she went through this program, and Brittany literally went MIA. And it was like, Brittany is in school. We're trained to know that Brittany is going to be doing homework or she's going to be in class, and we're not going to see her for 18 months. And she did that thing.
It's
She
literally like
did
you
that
don't
thing.
have a life. Like
You
nursing
don't.
school is your life.
Yeah.
Mm-hmm.
It's
Mm-hmm.
very time consuming and
Very demand and
demanding.
it doesn't matter if you do, like, a fast program like I did or just, like, a 2-year program. The amount of work and time that nursing school requires, low-key should be criminal because
Huh.
I
the
agree.
mental stress they put on you, and I think it's under the guise of trying to prepare you for working bedside,
Crazy.
uh, but, like,
Red flag.
I think they're, like, terrorists. These nursing instructors are terrorists, like,
Literally,
psychological warfare.
our
Ooh-wee.
nursing school offered us 10 free therapy sessions. And
See?
I had never been to therapy, and I was just like, let's go. I was in the lady's office breaking down. I was like, I didn't even know I needed to
Oh.
be here. I was just here because it was free, and there's 10 of them. I need every 10. I mean, all
Yes,
10.
absolutely.
Like, this is awful. And
Mm.
our nursing school, so I went to Baylor. Main Baylor is in Waco. Nursing school is in Dallas. It's like an entirely different school, and it's kind of a good thing because you don't have time to, I don't even know, to associate, congregate, none of that. Like
Right,
you're
you really
you're
don't.
like
You're just like,
isolated together,
go to
miserable.
class, go to lab, go to clinical, study, sleep, eat, repeat, whatever the order is. I don't even
Yeah, 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 yeah.
Literally.
and then
Even on the
cry.
weekends, it's like my whole life is consumed with a test that's coming up, a test that I just had, an assignment I'm about to
Mhm.
fail. Actually, just kidding. I made a good grade on this, but I need to make like a
Oh
57
my
on the exam to pass, but I might not make a 57. It's too much.
God.
Well, that's an amazing story. Yeah, I love hearing about people's journeys to where they've ended up in their career. So cool, cool, cool. Mariah, is there anything you want to add to the suite and tell us about your journey?
I'm just here for the filler.
I'm screaming. All right, love that. All right.
Wait, there
So,
is something I want to say. When I was in nursing school, I don't know if a lot of y'all know this, but I feel like if you know me, you know this. I had a baby on the last day of my first semester of nursing school. So I went to class and then, oh no, it was the day after. I can't even remember what happened, guys. I think I did go to
It's
class that day. That
drama.
morning, I
also,
was
the way you said it is, I had a baby. Y'all, she gave birth to her daughter. She didn't,
That
what?
she
just
didn't,
happened to have a
she didn't
baby.
just
I
happen.
mean,
Yeah, I just had
I
one.
had a baby.
I'm having a baby.
No one really knew.
Let me tell y'all, I went to a Christian school. Here in my air quotes, Christian school. Um, I had Amari on December 3rd. I gave birth to my daughter on December 3rd. Nobody knew I was pregnant until like mid-October. And I'm fairly
Really?
thin. But I remember the first time I wore a maternity shirt, it was like you could hear like the whispers and the looks and all the things.
Oh,
I was just
crying.
like,
Oh, brother.
girl, listen, I know you were hooking up with the star football player, but you just didn't get caught.
Literally. My God. My
At this
goodness.
Christian
Hey.
school.
Hey. And look at you now. That's all we can say. Look at you now.
Yes, I remember my first exam. What is it called? Is it foundations, Brittany? Like that first class where they talk about like, I don't know. I think it's a foundations class.
Well, okay, so I mean, it's like kind of generally all the same thing. We had it for us. It was called health assessment. So I don't, or maybe not. I
Well,
don't
we
know.
had a health assessment. That was more
Oh,
like
they're
clinical.
picnic.
Foundations was like, this is Florence Nightingale. She is the mother
Oh, we
of
just call that
nursing.
intro to nursing.
Yeah, that was our foundations class. But so I had Amari on a Monday, then I got out of the hospital on Thursday, and those were our dead days, which were like study days. And so then Thursday, Friday, Saturday, Sunday, I studied. And then Monday, I went and took my first exam. And I was a new mom, so I didn't know this, but I was literally sitting at the foundations exam or in the foundations exam, and my milk came in, and I almost died. It
Oh.
felt like a ton of bricks all of a sudden, just like, whoo, on my chest.
Oh,
And I didn't even
no.
care at that point. I was like, you know what? I have a pretty good grade in here. I'm about to take my chances. So I just start
Yeah.
like rushing through, circling stuff. I was like, I got to get out of here.
Yes.
Yeah,
That's a
that's kind of
story
my
of
story.
resilience. Yeah,
Crazy.
that's
Yes,
a story of resilience. And that's why you are a great nurse today. You know, you
period.
fought hard for that.
I have to
Literally.
say, there were a lot of moms in my program, and
Mm.
I can't imagine like being pregnant or juggling. Like my mom did that too. She had two children and was in nursing
Oof.
school. I
Ooh.
cannot imagine. One girl in my program had three kids, and I was like,
Ooh,
how? I'm
it's
barely
that
3 kids without
determination.
nursing.
And you know, they say the kids really, I'm assuming, I don't have kids, but I'm thinking once you have children, you are starting to, oh, my light was just,
Mhm,
wow, there's
mhm.
that.
And
But
then
anywho, once you
flashback.
have kids, they push you to, you know, do as best as you can. And so I feel like, Mariah, do you think that once you had your first child, you know, you're pushed to even do better than your already
Um,
ambitious self?
I think I was already pretty laser focused, and
Yeah.
then just the fact that people were like, "Oh my gosh, like she has a kid, like how's she gonna do this?" Like I
Oh
remember
yeah.
one of the what are they called? The advisors was like, "Oh, you should take like a semester off." And I was like, oh, "Okay." And then what happens then? And she was like, "Yeah, and then you'll just be like a semester behind." I was like, "I'm good. I'm gonna figure
Yeah.
it out."
Yeah.
So
Yeah. Yeah.
I think just trying to do stuff that people say that I can't do, and I'm like, "Girl, I'm about to deliver this baby, and I'm gonna see y'all in a minute." Like
Huh. And I'll be
it's gonna
back to
be
take this
fine.
test.
So I definitely think she pushed me too, because the story of resilience. Like I want her to know, like setbacks or whatever you may think is a setback doesn't always have to be. Like we figured it out. There was many nights I was like rocking and flipping
Mm-hmm.
pages, and I'm like, I don't know what this is, but I never failed a class. I never had to stay back. None of the things.
Mm-hmm.
So we're fine.
Yay. We love that. Okay. So
Like, where's she
Brittany, you
doing?
kind of touched on the Brittany, you touched on your first day in like a medical setting, like what was it, the scribe position?
Yes.
But I
It
want to
was
know from
hospice. Don't forget
oh
about
Oh, it
hospice.
was
yes, but I'm talking about like the gunshot wound and all
Oh
that, the
yeah.
traumatic stuff.
yeah.
Yes.
Mhm.
So I want to hear from both of y'all. I want to know what your first day was like out of orientation for nursing, or is it what is it called when you like, do y'all do training
Oh,
and
that's
stuff?
right.
Yeah,
Look at
orientation.
you.
So out of your I know because Brittany had to do it. I remember, but outside of your orientation, your first day as a fresh nurse on your own, what was it like? Give me the picture. Paint the picture.
Let me think, because uh I have a lot of trauma at work, so
Ah.
let me think. Actually, well, okay, so it worked out really well for me because my preceptor, the way that we not scheduled, but like plan my like last days of orientation, I could tell you what my last day of orientation was like. I cried.
Oh,
Um,
oh
that was the
no.
first time I
Not for
cried
that
on my
part.
whole orientation.
Oh.
Anyway, um, she planned it to where we were working 3 shifts in a row. The first 2 shifts were my last 2 days of orientation, and then the last shift was my first day off, but she was still working. So she was my neighbor. And so
Oh, okay.
good because I had her there. But honestly, I don't really remember. I was scared the whole night
Mm-hmm.
because I was just like, "Oh my God, what am I gonna
Yeah.
do?" I was like,
Yeah.
"Wow, this is crazy. How am I gonna be doing this?" But it was good. And yeah, like I just did it and I had my preceptor there. She was like, "Don't forget to do this, don't forget to do this." And then that was her last shift ever on nights. Um,
She said,
and
She was
"Girl,
like, okay, see ya.
I'm here
literally
today, but I ain't gonna be here tomorrow."
I love you. We went to breakfast the next day.
Oh, that's so nice.
That's
So
sweet.
honestly, that wasn't bad. Now, subsequent shifts, like the one I had last night, hmm,
Throw the
that's
whole
What
unit
okay,
away.
explain please that's
Wait,
the
wait,
back
wait.
to back to back.
Brittany, tell the people where you work. Did we get into that? Like where you work now?
I work in a neuro/neuro trauma ICU.
Mm-hmm.
So a lot of TBI, so traumatic brain injuries, a lot of strokes, a lot of seizures. What else? Sometimes I just kind of put it in the back of my mind. So many people, I guess that's a trauma, but like so many people who have fallen and like hit their head, a lot of
Oof.
older people, because every old person is on blood thinners for something
Mm-hmm.
that they have. And when they fall, they always hit their head. And what
Mm-hmm.
starts bleeding? Your brain. Um,
Ah.
so, patients with like meningitis,
Oof.
fungal meningitis, patients with aneurysms, a lot of stuff
Yikes.
like that. Yeah, so some pretty crazy stuff.
Are there younger
Mm-hmm.
people on the unit with meningitis?
Yes.
Y'all, I had viral meningitis like a week or maybe 2 weeks before I was supposed to do my first day as a nurse. I had
How did
gone
you
to
get
like
that? You got it from clinicals.
I no, I don't know. Because I was off for the summer. Like I had already graduated. I was waiting to
Whoa.
start like my actual job. I had gone to a family reunion, so there was a lot of people around.
Yeah.
Um, I just start having these headaches like out of nowhere, and I'm like a lay down, go to sleep, wake up, the headache's gone. Like I don't need medication.
Oh, okay, yeah.
But I was taking like Excedrin extra strength, and I'm
Oof.
not even like a medicine taker, and it
Oh.
was not touching it. And so I was like living with Austin at the time, and I was like, I'm just gonna go to the urgent care. Like maybe they can just give me something. I went to the urgent
Mm-hmm.
care, and they were like, you have a fever, and I was like, cool, but my headache, like, I don't care about a
Yeah.
fever, like, what am I doing? And they were like, well, we're gonna transfer you to the emergency room. And I was like, pause, like, why? And they were like, well, you might have meningitis. And I was like, wait, what? And
Excuse me?
You have to get
like
health
me with
leave.
meningitis, I have to start work in a couple weeks? No.
Yeah.
And so I went to like this freestanding Methodist, and the ER doctor was like, we need to do a spinal tap, we need to do all the things. And I was just like beside myself. And then he
Mm.
scared me. Let me just put a plug in here about bedside manner. Doctors, you need to have good bedside manners. This is why y'all have nurses. Like, let the nurses do some of the talking. He was like, we're about to do this spinal tap. If it comes out cloudy, then that is not good. If it comes out clear, then we may be all right. And I was just like,
What?
what? My whole life
That's
is hanging in the
crazy.
balance of this spinal tap.
Oh my God.
Can you explain for the people that don't
Oh,
what is that?
so a
Oh,
spinal tap. Let's let Brittany explain it.
oh. So it's basically so you've heard of a what is that thing called? Whenever you're Mariah, you can
An
answer this.
epidural.
Epidural.
Epidural. So you know how they put the big needle and they inject the medicine? Elise, are you with me?
And I've never had an epidural, but I can assume it's
It's
somewhere
So
MTV.
near because they
basically,
say it's a like one wrong move and
you're paralyzed.
yeah.
So basically what they do, there's fluid in your brain. It's called cerebrospinal fluid. If that fluid is infected, it can be bloody, it could be cloudy. It just depends. And there are different types of meningitis. So you've got the viral meningitis and you've got bacterial meningitis. Viral meningitis, honestly, we don't see a lot of viral meningitis. All of our patients have bacterial meningitis.
Yeah, they
Because
sick.
they don't get as bad
Right, to have
to need to go to the ICU.
but I do know our patients with bacterial meningitis have really cloudy, bloody, not great looking CSF.
Yeah.
So basically what they do is they lay you on your side, they numb the area, they stick the big needle in as if you were getting an epidural, but they drain out the fluid and then send it off.
Mhm.
Yes.
Oh,
So
okay.
Austin
Okay.
was in the room with me, and I was like, Austin, as soon as it comes out, you tell me if it's cloudy or if it's clear. And he was
Yeah.
like, okay, it looks like water. And I was like, oh, thank you, Jesus, I might survive.
Oh, yeah.
But then
I
they
can
still
imagine
admitted
how
me.
terrifying that is.
I
It
can't.
was
They
so
admitted you?
terrifying. Yeah, I stayed in the hospital
Yeah,
for like,
yeah, you
I
have to
want to
go.
say a good 3 days, 2
Because
nights,
you have to get
maybe
antibiotics.
3
Really?
nights.
Heavy antibiotics, IV antibiotics.
Yes. The lady was
Mm.
like, so Brittany, the precautions, like I'm assuming I was on like contact and droplet because with viral, you
Yeah,
probably don't know. But
yeah.
with contact precautions, whoever comes in the room, they have to wear a gown. And then with droplet, they have to wear a mask. I'm not
Mhm.
sure what unit I was on because by the time I got there, it was like super late and I was like out
And
of
you were
it.
distressed.
Huh,
You were distressed.
yes. I was
You're like,
like
I want to
halfway
die.
dead. Like, I don't know.
Oh, please.
I'm dying. Yeah.
But yeah, I had vancomycin. That's how I knew it was real. I was like, oh
Mhm.
Lord.
They brought out the big guns.
And
Now that
then
vancomycin is a heavy
That's
antibiotic.
a heavy
Okay,
antibiotic.
yes.
okay.
So that's my story about being in the hospital, other than when I was pregnant and having a baby. I was terrified. And one thing that I did know, my nurses did not clean my hub when they were starting my medication. I was already in there fighting for my life, and y'all were trying to give me more bacteria. I
Is
saw
your
it.
hub
I
where your
saw it.
IV is?
Yeah, it's like the
Yes.
Okay.
they plug in the tubing.
Okay, okay.
But this is in
Yes.
the EC, or this is in the ER.
Okay.
And I don't know if she did it when she drew my blood, but I'm just saying. I hadn't started my job yet, but I passed my NCLEX and I know that is wrong.
Oh, wow. Nursing is so interesting, and it's so interesting the people that were made to be nurses and the people that were not. I have a lot of respect for those that, and it's so funny that when you talk to someone in the medical field, especially in education and medical, typically you'll talk to people, nurses and those of the like, and they'll be like, I can't ever do what you do.
Ever.
Thank you for working with these kids. But and then on my side, I'm like, ooh, I can never ever do what y'all do. And so, wow, it's amazing. I really am. I have so much respect for nurses in the field and anybody in the medical field, especially even the techs and the
Period. Because
people
they do
doing the dirty work.
a
Heck,
You
lot, a
know,
lot.
yeah.
they respect to you, respect to the law. No, I'm just kidding. Oh no,
Seriously
he said
though.
respect to Allah. But anywho, respect to the techs and the. Remember the girl that went to Dubai?
No.
Oh my gosh, that girl.
She
And they
said
wanted
respect to Allah.
yeah,
Okay, anywho, back on topic. I have another question.
okay,
So
so
we've kind of talked on the very first day. Now let's get into the I want to hear the heartwarming stories and the stories that really made you think to yourself, this everybody has it. You got one.
I can think of
And
Right.
the stories that made you say this is after all the HE double hockey six I've gone through, this is why I do what I do. Can you share what's one moment from your career that made you that let you know that you made a difference?
hmm Am I going first?
Yep, always
Okay.
This is
for
about you,
the
Brittany.
yeah.
Oh, okay. So it was actually pretty recently, like maybe in the beginning of the year. So I mentioned earlier I worked in outpatient neurology with like a bunch of epilepsy patients and specifically patients with psychogenic seizures. So basically their bodies are having the seizure, but like if you hook them up to the EEG, which like measures your brain waves, there's no correlation. So medically they're not having a seizure, but like to a regular person, it will look like they're having a seizure. And it's because of stress, anxiety, depression, like any type of psychological issue. I had a patient recently and they came in for like seizures versus psychogenic seizures, but
Mhm.
they were having like physical symptoms, but like their vital signs weren't correlating because normally with like a real seizure, the main concern is super tachycardic and like you lose your airway. So
Mhm.
your oxygen levels are dropping, but vitals were perfect. And I looked at the patient when they came in on the stretcher and I knew immediately. I was like, "Oh, this is something that I know that I'm familiar with." So anyway, the patient was in the bed and I was just talking to the patient, getting to know them, and she was just telling me about herself and her life, and she started having an episode, and I was like, this is interesting." But I was just talking to her. I was like, "You're safe. You're in the hospital. You're in one of the best hospitals in the whole world. Whatever you're feeling, it's okay. It's okay to be scared. It's okay to be afraid." And I could literally see her coming out of the seizure within seconds. And I was like, aha, this is my why. This is my why. And it's funny because as much as I go to work and I'm like, God damn it, I can't stand getting out of bed. They're crazy. These doctors don't listen. And then you really do because of the stress of the job. You're like, why am I doing this? And what I
Mm,
it doesn't matter. They're not going to listen to me. Nobody listens to me. This patient's halfway hanging out the bed. I've re-restrained them 50 times. What more can I do? But then
mhm,
you have moments like
Close
this
the door.
where like you use all of the training that you have and the knowledge that you have, and it made a small difference because critically she was fine. But
mhm.
like in the moment I really did help her and I was like, "Oh my gosh." That's
Yeah,
it. And I felt like obviously I feel like a nurse every time I draw blood or pass a med, but like I felt like I made a difference. Like I
yeah.
I was doing my job, like actually doing my job.
Oh, I love that.
Yeah.
Oh, that's beautiful. Now,
Yeah.
That's the
was
nursing
she
difference.
just, yeah, was she disoriented? Did she not know where she was, or was she just
Yeah,
scared?
she was I think it's just she just has really bad anxiety and
Okay,
she has
okay,
a long psychological history, so
okay, okay, okay.
yeah.
That makes sense.
Mhm.
Oh, I love that.
Oh, me
Oh, I love that.
too.
That's a great. Did you tear up?
I did, I cried when I walked out.
Yep,
Yeah.
yep,
Oh.
yep.
Mhm.
That's how you know.
I felt really good. I was like, I did my job."
Yeah, yeah,
Really good. I felt really good about myself, and I felt good because I helped her, so
yeah. You should,
mhm.
and that's why you went into it. You
Yeah.
Yeah.
should. The reason. I
And
love
Mhm.
she'll
it.
remember you for sure. Like, I feel like
Yeah.
those moments are super memorable. So,
Mhm. Yeah. It was a good feeling.
Mm-hmm. Sister, did you want to share?
I mean, since you asked me,
She
um,
did.
a memorable experience. One that pops to the top of my mind is I was a pediatric nurse before I became a nurse practitioner,
Mm.
and there was this kid with autism whose mom just really struggled to get the kid to take medication, and all the nurses that tried, apparently, allegedly, mom told me, and she was like, "We've tried everything, they've tried everything." And I was like, "Well, listen, I don't have no new tricks up my sleeve." So we gonna do our best. But I don't remember what I ended up doing. I think I put it must have been like Motrin or something, which doesn't even taste bad, the kid version. I put
Oh,
it in
yeah,
a
it's the
cup,
bubble gum. I
like a
love it.
medicine cup, and then I put that cup in, like, inside of one of his favorite cups with a straw, and so I just had him drink it out of the cup, and I was like, "This is" to me, I was like, "I'm being dumb. This is not gonna work. Like, nobody's gonna drink medicine out of a straw." But he did it, and she was, like, so overwhelmed. She was, like, tearing up, and I was
Oh.
just like, "Yes." Like, I knew exactly what I was doing, even though I didn't. I was
Yeah.
Yeah,
just like,
it
"We gonna
feels
try
so
something."
good.
Tried anything. Yeah.
But then she nominated me for a Daisy Award, and she wrote so
Yay.
a Daisy Award, I never actually won one, but it's like an award
Did you get the
that
pin though?
people nominate you for being an amazing nurse. That's a quick summary.
Mhm.
But
Did you get the
I
pin?
didn't think it was a
Is
huh?
it a pennant?
Did you get the flower pin though?
No, I didn't win.
Is the Daisy? She just got nominated. Is the
It's
Daisy
so
Award
underrated. If you get nominated, you get a pin.
Oh, oh
Yeah, some of
bamboozled?
the nurses
but
they
they
walk around
bamboozled
with
me.
them. Yeah,
Yeah.
some of our nurses on the unit, they have like 7 or 8 daisy pins on their
Oh
badge because they get
dang! I
nominated.
have my
Yeah.
little
Go ask for
form.
your pin.
I know somewhere I
Yeah.
have the paper here. They gave me a copy of like what she
Yeah,
wrote.
they do write they give you the paper, but they
So
also
the
give you
days
Yeah,
a flower and a pin.
I
is
was
it
robbed.
across all of nursing? Is that a
It's
known
like
thing? It's not just on
universal.
your unit?
Yeah.
Oh.
I
It's
mean,
a
I say
nursing.
universal, like I don't know universal, but it's like
I'm
USA.
pretty sure
At
every
least in America.
Yeah.
nursing has like a daisy. Like it's like because everybody gets nominated and then it goes to like the big competition.
Oh. Oh,
Yeah.
that is so interesting.
One person
Yeah.
wins the Daisy Award.
Mhm.
Yeah.
Oh,
I've
I
Yeah.
love that.
But I
It's
thought
like
it was
teacher of the
like,
year.
"Oh,
Yes.
yeah, that's true."
Oh, I love it. I love that. Okay.
That's
Oh,
nice.
but Mariah, did you finish though? You were saying something.
I think she got
Was
nominated for the Daisy.
I?
Ah, okay. I thought you were
I
continuing.
think that's it. I thought it was like so simple, and I was just like trying to. I was just trying to do my job. Like I wanted him to take the medicine to feel better, but I think it was nice that it made an impact.
She probably was at her breaking point, and she just needed
Maybe.
one person to understand and
Thing.
one thing to go right, and you were the
Yeah.
thing to help the person to help something go right, and that was more than she needed, even
She
though
did
it probably
say
felt.
she commented on like my patience, and I was just like,
Oh,
you know what?
I feel like that's such a good compliment when you're a nurse because these patients,
It's
they will
listen,
have your patience.
it be in short supply at home.
Okay. I'm dead at that. All right. I love it. I love hearing about I love the passion stories. So love to hear about you being fulfilled in your workplace.
Yeah.
Okay, so I want to get into the nitty-gritty of it all. I want to get into the hard part of nursing just so we can get a realistic view on what y'all are out here doing on the front line. The first thing we want to discuss here is your shifts. And this is something that Mariah brought to
The
my attention, but
worst.
I have something to say because what is can you please explain what the different types of shifts can look like? What are y'all currently doing? Are you working holidays? Are you working weekends? What are we doing, y'all? Cause
Throw it
what?
all away. That's all I got to say. Brittany, you
Yes,
take it,
throw it
girl.
all away. Well, okay, so it depends on if you work inpatient, outpatient. Most of the time we work outpatient, it's a normal like 8 to 5, 9 to 5, whatever schedule. But then you've got your outpatient like surgical centers. Some of those places, my mom worked in outpatient surgical centers for most of the end of her career, and she worked normal hours, normal hours. She would always come home late. But some of them are like your standalone emergency centers. Those are still 24 hours. So you've got sometimes you got 10 hours, sometimes you got 12 hours. You get the night shift, mid shift, day shift. I work in a facility where it's 12-hour shifts and we only have night shift and day shift, and I work night shift. Um, and every hospital, every unit has different requirements. So so where I work, we're required to work so many holidays a year. I think it's like 3 major and 3 minor.
Hmm.
Um, and then addition to like basically every other weekend.
Insane.
Yeah.
It's insane.
Yeah. And
But who
How
else is
long the
gonna do it?
shift?
12
Huh.
hours. 12 hours.
Yeah. So you're working 12, 12, 12.
Yeah. I've recently though gotten to the point where I really try not to schedule myself for 3 in a row because the physical toll, because I'm not a spring chicken anymore. I cannot
Mm-hmm.
do I'm not
Mm-hmm.
there are like 22-year-old nurses that work in my unit and I'm like,
It makes a
y'all go
difference.
really it does like even working 2 days on, 1 day off, 1 day on, just that 1 day of just like pure rest and like hydration because sometimes you go a whole shift without drinking
Yeah,
water.
real
You might
life.
go to the bathroom one time, you don't eat your lunch, you will be lucky to have a couple of bites of whatever you happen to put in your backpack or whatever.
Mm.
One day of rest really does make a difference for me, and I'm okay with that. I am a baby. I do not pick up shifts anymore because
Period.
I'm not doing that. I'll do
Yeah,
it if they're offering extra pay, but even then, I still don't do it because no.
you don't want to, and that's okay.
What's the most you've ever worked in a row, Brittany?
4. And let me tell you something. I did it one time, and end of the shift, it was, oh my God, I cried. I cried. After that, I was like, you know what? It'll go like 6 months. I'll be like, okay, I can do it again. And every time I've scheduled myself for 4 in a row 3 times, and every single time I've called out on the last shift.
She's
Every
like,
single
I'm not
time.
doing this.
And every time my charge nurse will be like, I'll see you tonight. And I'm like, mm-hmm. And at 10 o'clock in the morning before I go to bed, I'm not coming.
Find
I'm not
somebody
coming.
else to do.
You
Prepare the
know,
Find somebody
others.
to do
okay,
it.
because I
If
won't be
I can
there.
get somebody to switch with me, I will. This last week, my schedule was so messed up because JCO is coming in. Everybody has to have the Joint Commission is our I don't know what they call them, like the accrediting board. Like if Joint Commission comes to your unit and you don't pass the survey. I don't know what happens because I've never actually heard of Joint Commission not passing
I
somebody.
know. I think
Mm,
the
It just says
hospital
that
like
you're gonna-
loses accreditation or something, and
Yeah.
then I don't know
So
what happens
that's
after
a
that.
big
Like, does
deal.
anybody care?
no.
Oof.
Shut us down, please.
Right.
So
LOL.
I don't want to come. Shut it down. But they've been on our butts about like making sure all of our like CPR stuff is up to date, all of our modules. So my schedule was messed up this week because I had to stay late to do my ACLS check off, stay late to do my BLS, and I had scheduled myself for 4 in a row, and I went to the charge office. I was like, you have to move me or I'm going to call in.
Mm, mm, mm.
He was like, are you sure we're really short that day? And I was like, you're gonna be even shorter.
Somebody else's problem, not
But
mine. Because why do they
Listen,
always be trying to make you save the world? Like, I understand
right.
that you're short, and so is my patience, and so is my mental
I
health.
can't physically do this. It was already enough that I scheduled myself for 4 in a row. Now I am now having to stay late on 2 days to do the stupid check off because you guys want it done before a certain date. No, I'm not doing it.
Huh.
Figure
Yeah.
Huh. You know,
I'm
I
figuring
am an advocate
you
for
have to.
that.
So,
PTO.
and they were
Prepare
short
the
and they were
others.
Yeah, you got to
preparing.
prioritize your mental health in this,
I'm
or
not
else it's just not
doing it.
worth it.
I can't do this.
Yeah,
And the thing
yeah.
is, the
I would.
hospital is going to function with or without you. So
Yep. That's why they
y'all
have
figure it
flow
out.
people.
Yeah, that's
That's why they have
absolutely correct.
they'll find somebody.
Huh.
Or
Well,
they will
Brittany,
be working. Those managers that make the big bucks.
Yeah,
how
they'll
long did it take you to come to that realization, Brittany,
um
that you were just not? I'm not gonna overwork myself.
I would say it hit after the first year because the first year I wanted to quit. After I first got off orientation, I wanted to quit.
Mm-hmm.
Um, not
Relatable.
simply because of the work, but nurse like bullying is not like it's not a joke. It really is a
Yeah.
thing. I wanted to quit because of that, but I was like, you know what? I worked so hard for this. Like, I really wanted this job. I would be doing a disservice to myself if I just walk out now. And I have
Yeah.
so much to learn. I'm so early in my career. Like, I can't give up on myself. So I pushed through. After the
Period.
first year, I was like,
Mm-hmm.
"How about this, y'all? This is crazy." And I wanted to quit. And then I was like, I just need to shift my perspective because I don't have to give this job all of my mental capacity. It's just a
Amen.
job
Mm-hmm.
Amen.
job. Like it's a
Mm-hmm.
very important job. What we do is very important, but like, how can you pour from an empty cup? So I'm going
Yeah.
to call in and I'm going to have my schedule switched. And
I'll try again in a couple of days.
yeah,
Yeah. Yep.
Let's
Yep.
circle
Yep.
back to this nurse bullying thing real quick because my friend Brittany is very nice. And I know y'all
Mm-mm.
wasn't up there trying to bully her. Pick on somebody y'all's own size because
No,
we are ready.
not me specifically. I will say because I am such a nice person, I feel like I wasn't made a target,
Mm.
but the amount of so you have your nursing preceptors, and it's almost always nurses with at least 2 or 3 years of experience. And that I feel like nurses coming in, like I've experienced nurses coming in like barely off orientation thinking that they're as good as nurses who have been on the floor for 15 years, especially when you work in the ICU because it's a bunch of pompous type A people who think that they know everything. I'm
Mm.
not like that. I love ICU. I know I'm a smart person. I don't have to brag about it or
Right.
one up the next person. But there are a lot of people like that. And there's a lot of talking behind the backs, like getting people's assignments moved, giving them harder assignments just to see them fail.
Oh no.
Really, really bad. And you would think, like, how can nurses of all people be this way? And I didn't believe it until I started working bedside, but the mean girls in high school really do become the nurses.
I was a,
There is
I was just about to say mean girl culture in
It is
Southern
Elise,
life.
very,
there
and
is
even
an
the same
entire like
thing.
concept of nurses eating their young. I know Brittany knows about
Yes,
this. And
yes,
it's bad. I don't know how it is now because I'm not bedside anymore, but it has
it's
gone
still going
like so far up to like a system level because it's like a real issue. You think like, oh,
Mm.
it's just like the floors and like the units. Like, no, it's like it
on.
goes up because people know that it can ruin people's careers, it can ruin their
Mhm,
livelihoods, all the things. So the thing is, nurses eat their young. It's like, well, I'm a nurse, I have experience.
mhm.
I'm gonna precept this baby nurse, but I'm gonna be really hard on her. I'm gonna be mean to her. I'm
What
not
is this,
gonna help
hazing?
her
Yes,
basically.
it's
And it's like
hazing.
she's gonna figure it out because I had to figure it out.
Yeah.
So when I was
It,
a preceptor, I was like, no, ma'am, no, sir. Like whatever you need, I'm over here.
mhm,
And it's just ridiculous because there's no need for that. But it does feel exactly like hazing.
mhm.
But they had the right one with me because
Huh.
I was day shift and there was
Oh,
even like this day shift versus night shift culture.
yes,
Like,
it's a very
oh,
heavy
you
day
had
shift
time to
versus
do
night
that
shift.
on day shift. Did I? It didn't get done. So guess what?
The
This hospital's
reality
24
is,
hours. I didn't do it. You do it.
thank you. I was just gonna say that it's 24 hours. So what? I didn't change the dressing. Guess what? You're
And
here for
that's
the
what
next
it
12
be. Little easy
hours.
stuff.
You are here for the next 12 hours. I'm sure since you think I have so much time, you can get it done, sister.
Yes.
Mm.
But like
But
you said, they know who to pick on and like
yeah,
all the things because there are certain nurses, they know who they are. Brittany, you probably know who
yeah,
they are.
yeah.
But they have reputations of like being more aggressive and like more
Especially when you're new. Especially when you're new.
Med search.
apathetic.
No, not
Oh.
necessarily. I think it's on
We'll
everything.
tell you off the
Med-
camera.
Uh,
But sometimes this one particular nurse, she would just find anything to nitpick about. She would be like, oh, you didn't take the IV out. Ma'am, the infusion just stopped 5 minutes ago and it's time for a report. Like, you take the IV out. Or it could be anything.
dang.
But I learned
It's a
that you
detail.
cannot let them intimidate you. So she'd be like, you didn't take the IV out. You're right. I sure didn't. Would you like to give report now? Would you like to hand off this patient?
Are we gonna do it all
If
day?
you
Because
have
I
time
want
to
to go
take it
home.
out, go ahead and take it out. If not, I'll be back tonight. But some nurses,
Exactly.
they get frazzled and they're like, oh my gosh, like, okay, let me go do it. And then they end up staying like 30 minutes late. And now she's still being mean to you and bullying you around because you're just doing whatever she told you to do.
Yeah.
No,
There's
ma'am.
no win.
Try it
Mm.
There's
with somebody else.
Yeah. And I think
Anyway,
after like the first year, I finally stopped letting because I was new and I was like, well, they know more than me. So, maybe I am doing the wrong thing. Maybe this little thing makes me a bad nurse. But then after a while, I was like, I've been
suck
here
it.
for
No,
13 hours. I've
Mm.
a lot of stuff for the past 13 hours. You know this because you were here the day before and you dealt with the same stuff. And you're going to get on me because I didn't get the patient up to go to the bathroom. the 10 times he had to go and he's here for a fall. Are you are you
Dumb.
okay? Hey, like, did you hear what you just said? If you want to get him up, you go ahead. And when he falls and you have to do an incident report on yourself,
Good luck
I'll
with
just
that.
Oof.
be in the corner, like, oh,
Yes.
yeah, okay.
Ooh-wee.
So
Y'all
don't eat
better
your
tell
young.
him.
You get nowhere being rude. You get nowhere being
No.
mean. It does
And
not
you
work
just
out for
get a
you in the
bad
end.
reputation on the unit, like, oh, that's them. And most of the
Exactly.
time, those
Oh.
nurses aren't even that good anyway.
Uh, uh, all the
Ooh-wee.
time. They are not.
They're not.
Yeah, that sounds like literal hazing, and I hate that some nurses have stepped fresh onto the floor and have had to experience that with these nurses that are so-called veteran or more experienced. Then
Some
why
people
not?
have
Why are you
quit.
gatekeeping?
They have
Oh
literally
my
quit
gosh.
because it's so bad.
I hate to hear that. I hate to hear that.
But not all nurses are like that.
Oh,
There are some
yeah.
Yeah.
Brittany's
Like
and
my
Mariahs out
preceptor.
there who will take
Yes.
these little babies in and teach y'all everything you need to know. And you can
That's how
always
my
ask us a
preceptor was.
question.
She was very
Oh.
sweet.
You might
You
drown a
would
little
think
bit, but
that
you ain't gonna die.
you would think that if you became a preceptor, is that what it's called?
Mhm.
Preceptor. If you became a preceptor, you would remember what it was like for you as a baby nurse on the floor, and you would want to provide the same, compassion and grace to any new nurse coming.
Unless
But
you didn't
the
get
mean girl,
compassion and grace. That's the
oh, and then
thing.
now you're
So
bitter.
it's like just a cycle. Somebody's got to break the
Mm-mm.
cycle somewhere.
Right. The mean girl doesn't work. And so, well, I'm so happy that my two sisters are very mature and very compassionate and some of the best nurses I know. All right. So I have like two more questions to ask, and I really want to get into this because
Yes.
um since the pandemic, I know nursing has changed a lot, kind of, right? Like it's
Kind of.
changed. So what are some of the most challenging parts of being a nurse, especially in recent years? And I'm gonna stick with following a pandemic and just the changes to it all.
Well, this is kind of hard for me to answer because I wasn't a nurse
Oh,
pre.
right.
So I can
But
tell you.
just in general, what's some
What,
of the most challenging parts of being a nurse?
um, oh man. Um, it could be anything.
Yeah.
The schedules are very hard, especially whenever you have a healthy social life. If
Hmm.
Yes.
all of your friends and
Oh
family
yes.
in the healthcare field, then it doesn't matter. But when you're like, whenever most of the people that you know and love don't, it's very difficult. And some people might not think it's a big deal, but it's hard for me. I feel really sad, especially on the weekends whenever I have to go to work and Ryan's here at home.
Yeah.
Uh, and then that's one really hard part for me. And then like just sometimes the communication between the different teams, like I feel like it shouldn't be this way, but I see this a lot, especially because I work in a teaching facility and we have a lot of new doctors who are just coming in, just establishing themselves and trying to navigate like what it means to be a provider. They have a hard time deferring to nurses for judgment and education. And it's really, really difficult communicating to them the things that your patient needs because they're just not receptive because they think they know better. I'm the doctor. They don't have enough experience and knowledge to know that your nurses are literally the front lines. They are constantly monitoring your patient. They know the subtle changes, so you have to listen to them. They don't think so, because they're the doctor. They know what's best, and it's really, really hard to not get mad and just to keep pushing and keep fighting and keep advocating because if I've called you 7 times for an order for a drip and you don't think the patient needs it, but I'm telling you the patient needs it, I'm just on the 8th time, I don't want to do it anymore. But at the end of the
Mm.
day, remember, well, who's suffering? Not me, the patient. And they're already in the ICU. There's nowhere else for them to go. We are the last stop.
I was about to
And
say it's
after
one
that,
more place they can go.
My goodness.
nowhere else,
Not the morgue.
We
the
trying to
morgue.
prevent this, sir,
So
ma'am.
Mm-hmm.
it's
Mm-hmm.
hard. The communication is it is very, very difficult, especially when you're working with new doctors because they don't know what they're doing because they're new. They don't have the experience, but they think they know. And you're like, well,
I've been here. You
this is
just
great.
got here.
All of us, now we're just gonna go. And at the end of the night, they always just end up giving you what you want anyway, but you have to spend 13 hours asking for it. And it's
Well, I see how that could be frustrating.
and
I
then
was going to say that we've learned in our friend group to reach out to Brittany first. Um, whenever we months in advance, whenever we plan something or need to plan something, we have to get Brittany first. Even though Mariah is a nurse, Mariah has more of a typical schedule. No, right?
Yeah, yeah,
Right?
yeah.
Yeah,
Even I
and
asked
so
Brittany, like, "Are you free this
yeah,
particular
God, I
weekend?"
always feel so bad when I
yeah.
say no
But I
because I'm
think it's you have to have supportive. I
sometimes
think you
I
have to have
Yeah.
supportive friends that fully, like I
yeah.
mentioned earlier, when you were in nursing school,
Mhm.
we tried to support you as much as possible. We didn't know. It was kind of like everybody went silent while Brittany was in school, and then when you came back out on the other side,
Popped out and showed
Like that.
everybody.
life got back to normal. And so that's just something that you have a circle of people that understand that this is your job, this is
Yeah,
what you're doing right now, and
I'm
if
very
we
grateful for that because
yeah,
I could easily in this job, like, have no friends because they would get tired of me constantly being like, "I can't go because I have to work."
yeah, yeah. I get
And
That
that.
will never
how
happen.
uh-huh.
Never. We
They
gon' we gonna change the day.
Yeah, because I understand.
or I'll
I
just call out.
No,
Don't do
I tell
it.
you, I'm like Brittany. You better not. We will reschedule if
I
Brittany
don't
can't
care.
make it.
For real.
Make
I
it
want to
figure
piggyback real quick off of what Brittany said about the schedule. I think that's definitely something that I struggle with too, being bedside with the 12-hour shifts.
oh,
Because the family part of it, of course, like the friends and stuff like you talked about in the events, but then when you have kids, so day shift, and it can be true with night shift too, just like the opposite, but day shift is 7 to 7, but it's really
mhm,
6:45 a.m. to 7:15 p.m.
mhm.
Daycares, most of them open at 6:30.
Yeah, how are
But if
you
you
getting your
gotta commute to work, like that's out. You can't take your kids to daycare. Daycares close at the
Mhm,
latest 6:30. You get off at 7:15. You can't pick your kids up from daycare.
yeah,
So especially for like single moms or like people whose spouse also work in the medical field or something like that, it can be super difficult to try to figure that piece out. And then just missing out on the little things at school, like, oh, I have like a school play today. Well, I couldn't get a switch, so I can't go. Or like, something on the weekend, like I have a game this weekend. It's like, oh dang, this is my weekend to work. Like I won't be able to be there. That was very hard for me and one of the motivating factors for me to go back to school because I did work outpatient. The money's significantly different outpatient.
it's so hard. Yeah,
You
I
don't
don't
make
know
as
how
much
they're
money
doing
as
it.
you do when you work in the hospital.
Mhm,
You have more traditional hours, so mostly like 8 to 5, or like Brittany was saying, if you work in surgery, sometimes it's like 6 to 3 or something like that.
yeah,
But the schedule is really hard when you have a family, and some people think it's not a big deal. Or I think they're just pretending, really. I
I
think
was
they're
gonna say
just
I
like
don't yeah,
Yeah,
I
I
agree.
remember.
I couldn't I couldn't imagine, like, knowing you're missing your kids, like, I don't know, award ceremony in the middle of the
Yeah.
day and you're here, like, I would be
Yeah,
and low key, I would leave.
Yeah,
period.
people
I
are
remember.
not as oh, go ahead, at least.
Oh, I was just gonna say, I remember Mariah when you were working your previous job, I think before this one, and we weren't as close, but I would still, speak to Austin and speak to the
Fight for his
kids, and
life
Austin,
in there.
I know, and Austin would be like, Mariah had to work, Mariah had to work, and
Yeah.
so I know that that's difficult. You're missing time
Yeah.
with your family on the weekends and stuff
Yeah.
like that. So I can imagine the struggle of it
Ooh, it
all.
still tugs on my heartstrings. I almost started crying, guys. Um,
No.
Another thing I wanted to say, it surprised me, but kind of, but not really. People are not as empathetic to the whole like I'm a
No.
nursing or I'm a mom thing. It's just like, so we can't always accommodate your schedule, so we want to go out too. It just like very
Oh,
abrasive,
Yeah,
and I'm just like, dang, okay.
yeah.
Especially when they don't have kids, I'm like, I hope one day you get to experience this feeling. And not because I'm being rude, but maybe because that'll teach you to have more empathy for the people that you
Right.
work around. I would switch with people. Like, I'm not gonna switch if I have like big plans on the weekends, but like
Right.
I'll switch with you.
If
If
you have
you
anything
trying to
going
go
on,
to your
yeah,
kids' stuff, I will switch. I do not care. Because
yeah.
listen, I have been there and I have been in desperate need of a switch and I have been told no by the whole list. So I've been there.
Yeah.
Yeah.
I'm the same. If I can, if I'm not already working, because 9 times out of 10, I'm already working. But if I
Right.
can't, because most of the time, if you're like coming to the group, please guys switch with me. It's not because you just want the night off to go to the bar. And then again, I always say, I'll call it anyway.
Yeah.
Brittany, she will call in,
I said,
okay?
I've
"Hello."
offered
I
people
am
money. Well, I've
crying.
paid people to switch with me before.
That's a big thing in nursing. Like one of my friends got paid $250 the other day to switch,
I will
but
never
he
pay anybody
Interesting.
that much a
family,
day in my life.
no, I
Uh,
wouldn't. I would
it's
I would pay
but
like
it builds
50,
community.
but his family was coming into town and he hadn't seen them in a very long
Call
time and he was
in.
very close with them. That's what
Okay.
I said. You just
Was
call
he?
it.
But don't
Well,
you have a certain number of
oh,
call-ins?
You
yes,
do. Brittany,
yes.
Okay.
have
See
you
the
ever maxed out
family,
your call-ins?
me,
Yeah.
uh, almost. But that was back when we weren't short staffed, but we're short staffed now, so the limit does not exist.
Oh,
Y'all,
period.
that limit is there's a thing with that because it's like when you're not close to the limit, you'll try it, you'll try it. When you're getting close, you're like, let me pull back a little bit. Like, let me get there on time. Let me not call in this time. Let me let some
That
of
was
them
me
fall
last
off.
year. Like, dang, I've called it too
You
much.
would think that, like, I guess working in a hospital or working anywhere, I feel like when you all are asking to switch and asking to get coverage and things like that, I that's what I meant earlier with building community. I feel like it because if I do this for you, I'm
Yep.
sure you would help me out in the future, and then we just build this strong bond of helping each other out. That's what I would envision it to be, but everybody doesn't think that way,
But
huh?
you know it's always one.
I
Take,
always
take,
one
take,
that's
can't give.
selfish.
You also have to
Hmm.
make friends with people who have different religious beliefs with you. Cause some people they never mind
Oh,
working Christmas. And I'm like, girl, every
yeah,
time I work Christmas, let's just switch and I'll work your
Yes.
Thanksgiving every time. Let's just make
yep.
it a thing.
That's a thing. Yeah.
Yeah, you got to be smart in these streets.
One of my
Yes.
coaches, she just left bedside after like 10 years. She said 5 years working on our unit, she never worked a holiday because she always found somebody to switch with because they wanted the money.
Yeah.
What is it?
The
Time and a
extra.
half?
Yeah,
Yes.
Wow. Oh, here's my random question. Why do y'all clock in at 6:37
because
or
the are and
5:26?
we paid by the quarter hour.
Say it again, I'm sorry.
Hospitals are cheap and we get paid by the quarter hour.
And they give you like
Uh,
they gave us
Right.
6 minutes
Say,
grace period.
yeah, so say um it's kind of hard to explain unless you've done it, but like say you clock it so from 6:38 to 6:52, you get paid the same amount. So
Mhm.
like actually if you clock in at 6:37, you get penalized. But if you clock in at 6:38 to 6:52, you get paid for that 15 minutes. If you clock in at 6:53, even though it's a 1 minute difference, you're considered late and you get paid a quarter hour less. Very basically. Does that make sense? No.
Interesting.
I didn't even
It
know
it
that.
it all boils down to it's more of a way for the hospital to pay us less because we literally get paid by the quarter hour. My things always say 12.25 or 12.5 or 12.75, depending on
Interesting.
Oh.
yeah. Mhm.
I wonder if
Okay.
ours was like that. I don't know though, but there were several days. We're supposed to clock in at 6:45. I'm clocking at 6:51 and I'm still on time technically. But the people I'm getting
Yeah, and you
report
you're
from,
getting
they be
paid.
pissed off.
Yeah.
Oh, we.
Don't really get mad unless you're coming so you have from like I said 6:38 since technically we're supposed to clock in at 6:45 but you have a certain amount of minutes before and a certain amount of minutes after.
Hmm.
If you sit your ass down at 7 o'clock with the coffee in your hand,
Mm.
I'm pissed because
Why?
what are you doing? Because
'Cause you've
report
had
on
coffee, I'm ready
Oh,
to go.
six. Oh, okay, okay. I get it. I get it. I'm sorry. That went
and
over my head.
then most of the time they come in with the coffee and they're like, "Oh, can you give me a second? I need to go clock in." So you're late. And
Oh,
you
the
had
people. Okay, I missed the whole thing. The people coming to relieve you came
yes,
in.
I'm
I
sorry,
would
when
knock
you're
that
coming
coffee
in
on the floor.
for a report and and there have been times where I haven't given a report until 7:15, and I'm like, "Y'all are
You lost your
me."
mind.
Yes,
Yeah.
for
Report.
coffee every time.
Mm.
Brittany, when you
Report?
give report or when you receive report, are you I need all the details? Listen,
No.
you could literally tell me the room numbers and what they're here for. Cool. I'm good. I don't need you to
Are
I'm
tell me
they
using
nothing else.
context clues, but is
oh,
giving report is giving a detailed
yes.
report on your
So
patients
it's
to the
like a
next nurse.
summary. Basically, like,
Got it.
this is patient A, they're this old, they got these allergies, this medical history, this is why they're here, this is what happened in the past 24 hours. You're
Okay.
up, tag in,
Yeah.
and then you do that every 12 hours. Some nurses, ugh, it takes 45 minutes to give a report, and I'm like, "You
Get
do
on with it.
that this is in the chart. You
They
literally
ask
just."
all these
Mhm.
questions, and sometimes I legit don't know because guess what, Becky? I didn't think about that all night. Go look and
No.
see what happened 3 days ago. I don't know. I wasn't here. I'm ready to go.
Oh my gosh, no. One time I was giving report to a nurse, and this patient was a fall. He had a brain injury from a fall. He fell down a flight of stairs at home. I shit you not. I'm sorry if I'm not supposed to cuss, but I shit you
All
not.
good.
He asked how many stairs he fell down. And I
Yeah.
said, "No."
Why?
I said, "I have no idea. You'll have to ask him that."
She
He
When he
asked
had to
wakes
get the
up.
full
stairs
picture,
he
Brittany.
fell
Was it like a
down.
fall? Was it a tumble? Did he roll?
Like, I wasn't there. What?
What are you talking about? Why does this matter? Are you kidding me right now?
I'm
That stuff used to
screaming
make
at
me
that.
so mad because then they would act like
I
you're incompetent. Like, oh my
Mm.
gosh, you don't know how many stairs he fell down? No, but I do know that I passed all these meds and kept him alive.
Huh.
Susan.
so
Yep.
I'm
you go
saying
in and
names of
ask
people I've
him.
never worked with. Just FYI.
No, but seriously, there are nurses who do stuff like that, and I'm like, "Are you okay? Did you have a bad did you have a bad day?" They'd be
Rough
like,
morning. All right. Okay. So we've talked a little bit about the inspirational side, and we've talked a lot about the tough parts of nursing. And I want you all to leave us with just a little bit of advice that
"Mhm,
you would give to someone considering becoming a nurse in today's society.
okay."
Don't do it. I'm just playing.
No. Okay, I would just say, like, in nursing school okay, first of all, nursing school is not what nursing is like. Nursing school sucks.
They lied.
It was never a good time. The only good part about it was my friends in nursing school. And some of
Makes all the
them,
difference.
yeah. Some of them I still keep in contact with. They were at the wedding.
Mm-hmm. Mm-hmm. Mm-hmm.
The nursing school is not nursing. Like, the, who you're not gonna have to do a dosage calculation before you administer a medication. That's what the pharmacy is for.
Period.
If you don't know an answer to a question, nobody's gonna like yell at you for looking it up or Googling it. Literally, they have so many resources. They want you to look this stuff up because they don't want you to harm your patient. So first of all, nursing school is not like nursing. So if you thinking of quitting and you really want to do it because of nursing school, don't quit. Just I don't know,
Push
push
through.
through. Push through. I don't know. You just gotta push through.
Yeah, it'll be over before you know it. I
Yes,
mean,
and lean on I was gonna say your coworkers, your classmates?
yeah,
Classmates.
your
Yeah.
cohort. Are y'all cohorts?
Cohort,
Mhm.
yes, that's
Mhm.
what they're called, cohort. Second, you don't have to work bedside.
They
A lot of
lied
yes, a
again.
lot of all of our instructors were like, you first of all, they tell you you have to work med surg first. That is a lie. You don't. I never worked med surg. I went straight into the ICU as a new grad, and all my nursing instructors were like, "You don't. You're gonna be so overwhelmed. You're gonna quit." Well, I'm still here 3 years later.
Huh? Whoa.
So
Period.
you don't have to work bedside. You don't, and if you do want to work bedside, you can go straight to the ICU. You can go to the cath lab. You can go to IR. You can work in the OR. You don't. The hospital has so many places, and they want new grads actually because they can train them to be the perfect
Mhm.
OR nurse, the perfect IR, whatever. So you don't have to start in med surg. If you want to work med surg, go work med surg. Don't recommend it.
Mhm.
But if you wanna go work med surg, go work med surg, but if you wanna work in the ICU, nothing is stopping you. There are so many residency programs that are designed to train you to be an ICU nurse or intermediate care nurse, an OR nurse, what have you. If you don't wanna even work in the hospital, you don't have to do that. There are so many places where you could work and live a nice, happy, stress-free life
Yes.
being in the outpatient setting. There
Yeah.
are, like, infusion clinics, that do, like, the IV, like, whatever, like, hydration and places like that that hire new grads. That seems like a really fun job. I would wanna do it. It probably doesn't make that much money, but, I mean, whatever, you'll get really good at IVs.
True.
Um you can work in any clinic. There are, like, standalone ERs. There are a bunch of places where where you can go where you don't have to work in the hospital. One thing I don't recommend is for nurses who are just coming out to immediately go into NP school because I don't think it's safe for them, and I
I
don't think it's
agree.
because you just don't have the knowledge.
Yeah.
And this is coming from somebody who even people tell me now I don't have enough experience to apply to NP school, which some days I'm like, "Yeah, they're probably right." Um, but there are nurses out there who literally jump straight from, like, graduating the BSN, don't work a day bedside, or they work, like, 6 months bedside and then go straight to an
I don't
NP program.
understand it.
And it's just you don't have the education, and it's not to say, like, you're not smart enough that you won't gain it, it's just you really
Experience.
have to have bedside experience and experience as a nurse to understand your role to then go and be a nurse practitioner.
And it really
Uh,
does help. I think the experience I was able to draw from the experience while I was in school. It wasn't just like a, "Oh, they want me to go and hold me back." No, like, it was actually useful.
yeah,
Mhm.
and,
Mhm.
like, the whole reason you became a nurse is to I mean, to be a nurse, so and, there are days where I'm like, "I'm gonna quit tomorrow," but then there are days where, like, that was really fun.
Imma quit
Like, last
tonight.
night, I had a really rough shift, like, pushed my patient to the OR emergently, and I was at the end of the shift, I told you my hair was sticking out like this. But I was like, "Wow, oh my god, I learned so much," and, like, I was tired and I was stressed, but I was like, "Wow, this was really good. I learned so much," like, stuff that I've been working on this unit for 3 years and I didn't know, and
Mhm. Lifelong learner.
so imagine just going straight to MP school, like, 6 months after becoming a bedside nurse. Like, what do you know? You don't know nothing.
Mhm.
Yeah.
Mhm. That makes sense.
Yeah.
Well, Mariah, anything to add to that?
My piece of advice would be if you don't like it, move around. Like your
Mhm,
unit is what I'm saying. You don't have to be married to an area. You don't have to be married to a specialty. As a nurse,
mhm,
you have that freedom to change your mind. And I changed my mind several times.
mhm,
There were people that told me, like, no, you need to stay in each area for a minimum of two
yeah.
years. Honey, I ain't got 2 years to give because if
Huh?
I wait 2 years, I might not be a nurse. Like,
That's the
tried
part
it,
right
didn't
there.
like it. Let me go do something else. Like, it's okay. I think back in the day, people took pride for like, oh my gosh, I've been on this unit since I started, and now I'm like 75 and I've only worked on this unit. Susan, nobody cares. Sucks for you because you're miserable. Move
I was
around.
gonna say you hate your job though, and your back always hurts, so why am I gonna
Yes.
wanna be like you?
And don't
No,
believe them. People will hire you. That
yes,
was
they
something I used to get
will.
told. They're gonna be like, "Oh, you look unstable, or you look like you can't commit." I didn't commit. Like, I tried it, I didn't like it. I'm going to try something else. But my skills, my resume, my interviewing
Mhm,
ability speaks for
yeah.
itself. So every job that I truly wanted, I got.
Mhm,
Mhm.
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 So
These are
move
all
around if
good
you
good
don't like it.
words. These are all good words. And this was an amazing conversation. I've learned so much in this conversation. And when you're friends, you know what? I was gonna talk about something else on the feed frenzy, but I'm gonna talk about something else. I just made up my mind. And when you are friends with people, I don't know what your work life looks like.
Mm,
You guys don't know what I'm doing. I can tell you I'm running an R. You don't know what I'm talking
No,
about.
I still don't know what an art is.
Yeah,
show no.
and
Sitting at a table, writing stuff down.
yeah. And I know that y'all are or in the medical field. And I know, what the basics of what nursing is, but I don't know what your day to day looks like. And so I've learned so much listening to y'all. Give us some insight on what your experience has been in I was going to say in the industry, in your careers.
Period. The medical industry.
Okay.
It is.
Industry. Oh
It's
my
an
gosh.
industry.
Yes. And so I think I speak for all of our listeners and everybody to say that we appreciate you all, what you do daily. You guys make a difference literally in people's lives. And we can't thank y'all enough for what you do as nurses and especially in our society today.
Oh
So
my God.
enjoy y'all's Nurses Week next week.
Happy Nurses Week, friends. Y'all keep going. Y'all are making the world go round for real.
Yes, making a difference.
Well,
It's really
it's never gonna stop. So, because of the world, I'm just
not,
saying.
not it's never
Why
gonna stop,
say
so we
this?
don't have an option.
I'm sorry. No, it's never gonna stop because of the world we live in. However, I will say that, like, just like there are good nurses, there are really good patients who don't treat you like you're less than,
That's
who
true.
treat you with respect, who understand that your job isn't just to cater to them, and they listen to you. I do have good patients, y'all. I had a really sweet man. Oh my gosh, he had a fall. And he was just the sweetest man, and he was like, "I know I can't get out of the bed because I already
Oh.
you didn't argue with me, you didn't fuss with me." It was just such a delight. Yes, it really was, and he got transferred out the next day, and I was like, "Dang, why can't you stay another night?"
Oh.
The good ones always leave too
I
soon.
know.
Yes.
Like, I don't want you to be in the ICU, but I want you to be in the ICU.
Yes. We thank you so much, Brittany, for being
Thank
our
you,
very
Brittany.
first guest on
Yay!
yes, here in the Sister Suite.
I know I'm kind
Yeah.
of all over the place.
No, listen. I was about to say you speaking to thing one and thing two of all over the place.
Wait, look at
Uh
my shirt, guys. I wore this special for the episode. Perfect timing,
oh
all over the place.
yes.
It says Boo Crew.
Oh, that is cute.
Oh, I love a cute nursing shirt.
Same. I'd be
Did you
I
get
buying
it
them
love
from
it.
all.
Etsy? Did you get it from Etsy?
Huh?
Did you get it from Etsy?
Oh no, this was actually a shirt our unit made, but it was like not an official hospital shirt, so I don't know if we
Oh,
were
yeah, we
actually
do that
supposed
all
to
the
wear
time.
it.
I don't care. I don't care. Because the scrub tops, they can be kind of constricting, so I prefer
Yeah.
to wear t-shirts.
Yes.
Mhm.
Yeah.
Well, thank you again for all that y'all do. And thank you so much, Brittany, for joining us on this special episode of Celebrating Nurses for this Nurse
Hey,
Appreciation Week.
nurses. We're probably
Happy
gonna get a
Nurses
pizza
Week.
party.
A pizza. You know what? We wait till the
I
teacher
want a raise.
appreciation episode. Just wait.
We're gonna get a pizza. Oh my God, y'all. Okay, I know we're supposed to be wrapping it up, but last year they gave us hot dogs.
Hot dogs.
You know what? The
Ew.
correlation of teaching or education and nursing sounds like there
It's
are a
right there.
lot of, I mean, y'all were saying a lot of things, and I was like,
This
that
sounds
sounds
familiar.
familiar.
Because it's all because of the public service that
Yeah.
I don't know about you, at least, but I think teaching is a public service if there ever was one.
Oh, absolutely.
Right.
Yes.
Because it's the nature of because we give, like that is our job.
That's right. Give of
Yeah.
yourself.
Yes.
Yep. Yep.
And to expect nothing in return. So
Right.
I
So take that hot dog and close your mouth.
we
That's
did
what
get
they say.
dessert.
Both.
I didn't eat it because it would have made my stomach hurt. And then who would have watched my patients?
Oh, yeah, that would have been too much. Too much. And with that, we are wrapping up our segment of nurse appreciation. And everybody tell Brittany thank you in the comments and how much you appreciate the nursing in her. Love you, Brittany. All right, we're moving along to Mariah's segment.
I have something that I'm going to talk about that kind of relates to what we talked about with Brittany. But let's let Elise go first. Elise is going to be a guest in my segment today.
I'm
I love it.
hijacking Mariah's segment today, and I did it because also my something has to do with Brittany, our guest today that we just talked with for such an amazing conversation. gave, and I talk about what she gave us in our bridal bags when we were her
Yeah.
bridesmaids in the wedding so much because I love it all.
And can you just give me one already? Dang. Stop
Listen,
rubbing it in my face.
if you know Brittany keeps cuticle oil in
Oh
her
my gosh.
purse.
We love Brittany for the cuticle oil.
And she always asks us if we want some cuticle oil. And I used to be like, girl, this cuticle oil, no. But she gave us some in the bags. And listen, look how much cuticle oil.
At least been paint her fingers.
I just be sitting in the car like just be cuticle. It's so soft and oily. So Brittany gave us this, and I don't even know if it's like I don't even know where this one is called Nail Honey. And it says, let's grow so strong, looking long, time to re-up, nailed it. And so it's just a little twisty cuticle oil that you can keep in your purse. And so I just wanted to bring it to the wellness segment as something to add to your purse repertoire to keep your cuticles from being dry and crusty, and to just, when you're sitting, maybe like being a passenger princess in the car or sitting and doing something randomly, pull out that cuticle oil and oil those cuticles. Because they do get crusty and crack. Yes.
A moisturized cuticle goes a long way, y'all.
Right. So I wanted to bring the cuticle oil to the pod because I think that this is not a normal purse thing. And so I think we should make it a universal thing to add to your lip oil or your lotion and your cuticle oil.
I love that, Elise. I'm so glad you brought that.
I thought it was I was like, let me bring it to the pod because Brittany gave it to me, and Brittany was our guest today. And then this is real quick. This is a lip liner stain. I just bought this from Ulta. Man, you can't see because of my lighting, but this is a lip liner stain.
What brand
it's like
is
a tint. It's Satchu brand, and it's the color Hazel. And it is a lip liner tint that you put on your lips, and it dries kind of like it's a peelable tint. And so you put it on your lips as a lip liner. You leave it on for 10. I did 10 minutes last time. I needed to do longer. So I'll do maybe 20 minutes next time. And then like while you're getting ready, and then you peel it off, and it stained your lips as lip liner. I tried it on Sunday at Easter, and I loved it. So I wanted to bring it to the pod for our makeup girlies. It's a lip liner stain. Oh, this one is lip liner staying. Oh, that's so cute. There's lots of different brands. You can just probably order it on Amazon. I got this brand from Ulta. And so girlies, go try it and then bring it back and let me know if you like it. Okay.
My 12-year-old wants a lip liner, and I'm always like, girl, why you need a lip liner?
Hello. Okay. The young girlies are really into lip oil and lip gloss combos. Girl. And so you've got to have a lip liner to make it pop. So I can relate to my niece.
Lips like nobody's tomorrow. I'm like, why are you out of fat oil? And I just bought it.
Yes. So maybe try the lip, and it was $12. So the lip stain, and you don't use that much, and it's a big tube. And you put that lip stain on, and it's not too crazy. It's not like Hazel would be a good color for her. We're about the same skin tone. Okay. And so it would be a nice age appropriate tint color for her.
Try it.
Mm-hmm. Yes.
All right.
Okay. Well, done hijacking.
Some goodies. You can hijack my segments anytime.
LOL.
My wellness was just going to be talking about PTO. I don't know if we actually mentioned PTO as like what it actually is, because we kept saying prepare the others. That's also what PTO is. But PTO, like vacation time, stuff like that, y'all do not be afraid to use your PTO. You literally earned it. Sometimes you need to throw a random PTO in the mix. Like aside from vacation, aside from planned holidays and
absolutely
stuff like that, throw you a random PTO day in there. It is life changing.
Oh, absolutely. I take one a month.
Yes.
I take a day a month. Because we don't get PTO. We get certain days a year, but they roll over.
Yeah.
And so you can easily, we work 9 months out a year. So you could easily take one a month if you don't take any other, because typically we don't take long vacations.
Right.
We have summer.
Yeah.
So one a month
Yes.
to do nothing.
You need a reset. Just do nothing. Yes,
Yes.
exactly. Take
Yeah.
that day because it is yours. You earned it.
Mm-hmm.
Don't feel obligated to even think about work. Just
Mm-hmm.
plan. If you have trouble like setting aside time, just
Mm-hmm.
start choosing a random day. Request the PTO. You might forget about it. When it comes up, you're going to be like, oh, I got a day off. And then you just do nothing.
Yeah.
Absolutely
Also,
nothing.
don't. This is probably bad practice, but I don't have to tell you why I need to take off. When I request off, I put, when they say notes, I put not applicable,
Because
because
there's
you don't
no
need to
note.
know why I have to be off.
The note
You just need
is
to know this is
mind
my
your
day and I'm
business.
taking it. Literally that.
Yes, that.
And I'm not
Yeah.
asking for permission. I'm sorry. I am giving you a notice that I will not be there.
That's
And
the
so,
thing. It's like, it's a request. It's actually a demand. But
literally, because I won't be there whether you approve it or not. And I'm not saying this in any type of arrogant or
right.
something way. I'm just giving you an
Heads
advance
up,
notice
like,
that I will be out respectfully. And that's
because
that
it's
on
my
that.
time. Like I need it.
Yeah. Yeah.
But Austin had been telling me like you just need a PTO day. And in my head, I'm
Yeah.
like always trying to strategically plan my PTO around when the kids are going to be out. Because sometimes they have like those random Mondays or Fridays
Yep.
off. And I'm like,
Yep.
I kind of want to be out with them. Or let me save it for when we're going to have a vacation. But sometimes you just need that random day. Even if they're at school, that's even better because then I can just like
A day
really
to
do
yourself.
nothing. Yeah.
Yes.
So that's my wellness tip advice for this week. Take your vacation, take your time off. It doesn't always have to be planned. And I understand some people have very limited days or they have like big vacations planned where they need all their days. So if you can strategically plan it to where you can get at least one random day every now and then, I think it
Right.
does a lot for your mental health.
It does. It does.
That's it, y'all. That's all I have for wellness.
Love that. And so with that, we'll move into the feed frenzy.
This is good.
So the feed frenzy, I had a whole nother, I wanted to talk about the movie Sinners. I haven't seen it yet, but I wanted to just talk about what I
Same.
had been hearing and what our expectation is. But I think we can circle back to that because I think we're going to be, people are going to be talking about that movie for a while. So today, after our conversation regarding nurse appreciation and our friends and their careers, I wanted to talk about a trend, and it's not really a trend, it's just something that I've been seeing on social media here and there. And it is a girls' night in where you present what you do to your friends.
But without telling them what it is?
No, you tell them. You make a
Oh.
Canva presentation. And it's probably the nerd in me. It's the mega nerd in me and the mega goofy in me. But I think it would be so neat to have a Canva presentation with visuals and terminology of presenting to me what you do in your daily day
I
life.
can see that being fun.
Yes, like who are your work friends?
Yeah.
Like what do y'all do for lunch?
Yes.
Do you get an hour?
Right.
What does your office look like?
You remember I texted you the other day and I said, this is my work ally?
Yes.
Like, you be wanting to know, like,
I want to know, like, what is because you're at work.
Yeah.
5 days out the week.
Literally.
Yes, we are close friends. Y'all are my best friends. But you are spending most of your day at work. Who are these people? And what are you doing there? And so I want to have a girls' night. Probably, I don't know. We got a lot going on, so it won't be anytime soon. But I want to have a girls' night where we prepare presentations. And like you'll hear me talk about like my coworkers, not bad, just like be like, oh, so and so did this, and like Jared, my husband, he'll know people's names, but he don't know what they look like. He don't know nothing. But it's like
we
I
need
just
bios and pictures.
Yes, like now this the one that did this, and then like show me your workspace. Show me your.
That sounds fun.
What do you wear to work?
Like cribs for offices.
Yes. And then I want to know what are y'all doing? Because I tell y'all that I schedule meetings and I sit in meetings all day, but y'all don't know the nitty gritty. Y'all don't know the half of what happens in that office at my job.
True.
And so Yeah, like I just want to see
Bring your
is
friend to
the
work day
nosy.
via your
Yes,
presentation.
yes, bring your friend to work girls night or something like that. I was seeing that on TikTok and I was like, "Oh, I want to do this with my friends. I want to know
So
like
cute.
yes, like like Danita, she's in education, but she's in a whole nother side of education than I
Yeah.
am. What are you doing? Tell
Yeah.
me, show me your team. Like I want to know them.
That's so
So yes.
true. I think we take for granted that most of the language we have around work and the conversations are taking place with people who also do the same thing as us.
Literally that.
So sometimes I'll say like a terminology to Austin and he'd be like,
Yes.
what is
What?
that? So for
Literally.
example, sometimes I say stat. I think most people
Mhm.
from the medical shows know stat means like immediately or like right
Mhm.
away.
Mhm.
Or like PRN is like as needed. So when I talk
Mhm.
to my friends that are also in the medical field or my family that's also in the medical field, and we're talking about like, oh yeah, I was just taking a PRN. They know what that means. But if I say that to
Mhm.
somebody not in the medical field, they'd be like, what do you mean
Literally, I
PRN? What
just
is that?
experienced this. I for the first time because typically I'm the one saying all the acronyms and my friends
Yeah.
are like, what are you talking about? But
Yeah.
in this podcast today in y'all's
Mhm.
conversation, I was so into it because I'm for the first time I feel what the people are saying about me and my 50,000 acronyms that I use.
Mhm.
And you don't realize like everybody don't know what these acronyms are that
That's
you're
true.
saying mean.
That's
And
true.
so that's another thing I want to add to my because I want y'all to know what R stands for. What is what is an LPAC? What is a TELPAS? I want y'all to know.
It's too
You're gonna
much.
leave knowing what what does STAR stand for? Y'all gonna leave knowing what these acronyms mean so that when I say them, you can be like, oh, that's an an annual review and dismissal meeting. So yeah,
Yes.
why am I
'Cause
so
when you say
excited?
R now, we'd be like, all right, she'll be back in about 2
This
hours.
meeting. Yes. She finna go in this meeting. So yes, I think that would be so fun. And I don't know
Yes.
if it's because I'm now, entering into my 30s and just living life and like
Your 30s, girl, you was in your 30s.
I was gonna say mid 30s, but then I got shook because what is life? But I find that fun. Like
Did
I
you
want to
listen to the
know.
Friend Zone this past week?
I did. I just finished it today. It took
And
me
they talked
2
about the
days.
mid 40, like what are the
She said
numbers?
43. She was like, I thought it was one before 45. Fran was like, I thought it was one before 40. First of all, why is she? I never would have thought. Never
Friend,
would have thought she was that age.
goals, man. You look
I thought
amazing.
we were the same age.
Listen, like, hey,
I
girl,
thought she's a
I'm trying to
whole
be like
10
you.
years. Yes.
That's
10 years older
exactly
than us.
when I did the calculation. I was like, oh my gosh, Fran she's that much older than us.
Yes.
I love her. She's my big
Beautiful.
sister.
Literally that. And she was saying mid. Oh, yes, that's such a good point. Like she was 45 and then 40 is 44 and 46. 44 through 46 is considered mid 40s. And Dustin was saying, no, 45 is mid 40s. But I kind of agree with Fran.
I think, yeah.
Yeah, I kind of agree with Fran.
So like 34 through 36, that's mid 30s. And then
I would think so.
38, 39, 40 is.
Yeah, because it's 333. I would think so.
Yeah.
Mid is a range, I think.
Yeah. So
I don't
30
think it's
to
like
33 is
literal.
early.
Mm-hmm.
34 to, yeah, I think so. I think I agree with her.
I think it's a
Sorry,
range.
Dustin, but we love you too, Dustin.
I know,
If you ever hear
love.
our podcast, we're obsessed. We already told y'all that. So
We talk about friends on every single podcast, and that's all
Yeah.
right because we love them.
And in our text threads and all the things.
Yes. All right. Well, that's all I wanted to talk about for the feed frenzy. It's just this trend that I've been seeing on the TikToks, and I want to bring it to my friend group. So those of y'all that are listening, along with my sister here in the Sister Suite, get ready and start working on your Canva presentations now.
Period.
And I want a very clean, bulleted. I want visuals. I want transitions, animation.
Love a bulleted PowerPoint.
I want it all with
Nothing
pictures.
Like
Thank you.
PowerPoint.
And that's that on that.
Some handouts like
not
necessarily paper, but you know how you have to bring something related to
yes.
Bring me an apple or something if you
bring
something.
I'll bring you the peppermints that everyone eats out of the jar in my office. I'm the peppermint lady. The little soft peppermints. Mm-hmm. Yep.
I mean, I do love a peppermint. I ain't gonna lie. I love a peppermint.
I tear them soft peppermints up.
They go so fast, and you just be like so good.
Literally that. I'm dead. Well, sister, with that, we
Y'all,
just
we have had a time today.
it's been a good
whole
episode.
time.
This because it's May. That's why. It's because it's
We
May.
out here acting up. And I'm lying. We are in the bed by 8:30.
Listen, I'm finna go get right in the bed. And so
I'm
with
gonna
that,
immediately close my eyes.
literally, I gotta go self-tan. We're gonna talk about let's talk about self-tan on the on the
Figure that
wellness
next
segment
time.
next week.
Okay. I'm gonna have to try it out. Then we can talk about it.
Yes, you gotta do it. But anywho, I hope everyone has an amazing week, and remember to thank a nurse, because nurse appreciation is next week, and all nurses deserve to be thanked. The ones that know how to act.
And we love a nurse. We love a good nurse.
Yes. So remember that sometimes we rock it,
and sometimes we get rocked, especially when we try to check people and ask them, are they sure about stuff that they know? But either way,
we rock it.
Period. That's all.
Toodles.
Bye.
I'm dead.
Thank you so much for watching our podcast. This episode and every episode is produced by Elise and Mariah.
Don't forget to subscribe to us on YouTube, where you can watch our full episode at the Sister Series Podcast.
Also, follow us on socials, Facebook, TikTok, and Instagram at Sister Series Podcast.
See you next time.